For so many of us here in Nigeria, there's that quiet moment of anxiety, that feeling when your phone buzzes and it's the message from the lab saying your results are ready. Today, we're going to change that anxiety into understanding. Let's really get into what your lab numbers mean right here in our Nigerian context.
You know the feeling, don't you? That message comes in, it's a PDF. Your heart does a little jump. You open it, and your eyes just scan, looking for anything in bold, anything with a little H or L beside it. And just like that, your mind starts racing. It's a very, very familiar Nigerian experience. But okay, before we go any further, let's get one thing straight. A lab result, it's not a final verdict. It's not a judge giving a sentence. Think of it more like a signal. It's just a little message your body is sending you. And our goal today is to learn how to read those messages calmly without fear. So, you ever wonder how doctors can look at that same piece of paper and stay so calm? Well, it's because they're trained to see the bigger picture. It's really all about context, not just the numbers on the page. You see, a doctor is putting together a puzzle. First, they look at your symptoms. How do you actually feel? Are you tired? Are you feeling great? Then, they look at your history, your age, your lifestyle, any sickness from before. And third, and this one is so important, they look at the trend. Is this number a one-off, or has it been creeping up over the last few tests? That's why one single number is just one tiny piece of the whole puzzle. So if you take anything away from how a doctor thinks, let it be this simple rule: context before panic, always. It's about understanding the full story, not just reacting to a scary headline. All right, so let's get really practical now. Let's talk about panic versus prudence. What are the things we panic about that we maybe shouldn't? And what are the things we need to be prudent about, meaning we take them very seriously, even if we feel perfectly fine? Okay, here's a classic example. You see a slightly high blood sugar, and your mind immediately shouts, "Diabetes!" But hold on, did you sleep well the night before? Are you stressed? Did you fast properly? All these things can cause a small spike. But on the other hand, you have high blood pressure. That one is a silent operator. You often feel nothing, but if it stays high, it's causing damage. That one needs your attention. And here's another one. Mildly elevated cholesterol. Yes, it's a bit scary, but you can see it as a warning sign, a chance to maybe start walking more or change your diet. But a consistently high fasting blood sugar, or that HbA1c test, now that's different. That tells the story of your sugar levels over months. That trend needs to be taken seriously. And finally, this one is for us here in Nigeria. Slightly raised liver enzymes. Wait, think for a minute. Have you been taking painkillers? Just finished a malaria treatment? Or maybe one of those herbal mixtures? All those things can bother your liver for a little while. But your kidney markers, if those are staying high, that's a more serious signal about your body's entire filtration system. Let's just pause on this number. 140/90. Look at it. If your blood pressure is consistently at this level or higher, you need to take action. It does not matter if you feel strong like a lion. This number is a clear, undeniable red flag. Please don't ignore it. Okay, let's bring it all the way home now and talk about something really important: the Nigerian factor. Because our daily lives, our food, the heat, all these things play a huge role. Just look at this list. I'm sure it sounds familiar. Who hasn't had a late dinner and still gone for a fasting test? Or taken some agbo or herbal mixture? Or you're just getting over malaria? And the heat. Not drinking enough water can change your numbers. Even the fact that labs can vary. These things are our reality, and they matter a lot. Here's a perfect story for you. A bus driver, his results came back with high liver enzymes. He was so worried. But you know what the doctor found out? It was the herbal detox mixture he was taking every morning. Once he stopped, his liver numbers went right back to normal. You see, context is truly everything. So now we know all this, but knowing isn't enough, right? We have to move from knowing to doing. So let's talk about a simple, calm action plan for when you get your results. First things first, if a result is just a little bit off, borderline, don't go into a full panic. Just repeat the test to be sure. Second, try to track your numbers over time. Keep a little note. You're looking for a pattern. Third, start making small, healthy changes today. Don't wait. Fourth, if you see a real red flag, like that blood pressure number, go see a doctor. And finally, please, I am begging you, avoid the WhatsApp diagnosis. Don't forward your results to 5 different groups for their opinion. Talk to a professional. Because,
At the end of the day, the real goal of all these tests, it's not to add more fear to our lives. The goal is to give us a sense of calm, control, to empower us so we can build a life of lasting health and well-being.
So, I'll leave you with this thought. That lab result is a signal. It's your body trying to talk to you. It's not a verdict. So the real question is, are you ready to listen to it calmly and wisely?